The coronavirus, or COVID-19, whatever the name you would like to call it, has affected everyone, every countries around the world. Shops are closed, schools are closed, restaurants are closed, even some countries close their borders. The number of cases and deaths never seems to stop. No one knows when the coronavirus will stop. As a normal person, I keep following the situation closely to see what action should I do to prevent getting the disease. One thing really confuses me, and I'm sure this applies to you. Yes, it's the mask. I live in Asia, and people in my city wear masks every day, and we try to buy as much mask as they can once possible. It's like daily necessities in Asia countries. Well, it's common sense here. Wear a mask before you go out, even you just leave home for a few minutes. We wear a mask because we are aware of our own health. That is how we interpret the wearing of mask. Even we seems not sure why and how wearing the mask will help us to prevent contracting the coronavirus. It's like a ritual here, that you should wear a mask. If you do not wear, people will have a bad opinion on you probably. Then I try to search articles on whether should healthy persons wear the mask if they do not have any symptoms in the Western media in February. The results confuse me, comparing with the common viewpoints in my city. They all nearly emphasize that there is no need to wear a mask, and this is supported by different professors from universities. The guide from many countries' health department also emphasized that there is no need to wear a mask if you are healthy. On the contrary, the professionals from Asia emphasize that everyone should wear the masks. So actually, should we wear the mask? Why are there such polarized opinions between the West and the East, no matter they were normal citizens or professionals? In order to find the answer, I try to investigate on this, and this really takes me a long time to do so. The mask we wear today, as its name suggests, surgical mask, was proposed to be used for surgery purposes long time ago. Time went back to around 1900. At that time, Karl Flügel, a German bacteriologist and hygienist, demonstrated that ordinary conversation between normal person could release droplets with bacteria from the nose and mouth. This further uncovered the danger of human exhalation triggering surgical wound sepsis. In 1905, Hamilton proposed in her research that scarlet fever could transfer through droplet infection, so she advocated the use of masks. This was recommended to nurses handling sterile dressings and doctors at the time of surgery. This was probably one of the first recommendations that surgeons wear masks. At this stage, the surgical mask is only made from 1 or 2 layers of gauze, unlike those we see today. Apart from using masks inside the surgery room, soon masks were used outside medical settings. In 1918, the Spanish flu spread around the world, just like what coronavirus doing now. The mask started its function in the community. This generalized wearing of masks was initiated in the USA. At that time, public health authorities tried to implement social distancing measures at an unprecedented level of intensity, just like what countries doing now for the coronavirus. Such measures like public gathering bans were suspended only on the condition that masks were worn instead. Several American cities legalized mask wearing for all citizens in public places, and it was recommended in the UK also. And this was not merely a regulation being imposed on the public. It was the general public who showed their own social discipline on this matter, as according to Toms. Mask wearing gained popularity and acted as a symbol of public discipline. The public participated voluntarily on wearing the mask. Such discipline even regulated back to those officials. One commissioner of health was fined for not wearing his mask at a boxing match. Polarized opinion on the mask existed also in the past during the pandemic. One health commissioner declared that the wearing of mask was worthless. Even there are evidence against the utility of the masks, these arguments were secondary to their social function, as was indicated in the 1919 publications Lessons of the Pandemic, as cited by Toms. Even doubts arises on the efficacy of masks. It's always better for the public moral to do something than nothing, as the general public will not suffer for the additional care which is given to it. Such statements and situations were so similar to the situation nowadays, as we can see later. The next public mask wearing event comes to SARS in 2003. The phenomenon mainly occurred in Asia and was considered to be the main reason why people in Asia developed a ritual in wearing masks. In Western countries, there were no such idea of wearing masks to prevent getting SARS. 3 scholars recollected when they traveled from United Kingdom to Thailand, there were no one wearing masks during the flight. No information about the SARS was given as well. Only arriving in Thailand, they saw all staffs wear the masks. These perceptions on the use and value of masks as means of personal protection against the infection were one of the differences apparent in the response to SARS between the East and the West. In Hong Kong, citizens there perhaps have the strongest sense of wearing the mask during the pandemic. Many photos of people wearing masks everywhere were taken. Surveys conducted in April and May 2003 showed that 76% of the population wore a mask that time. You could argue that there are public fear on this. However, such fear was more inclined to be self-induced by the general public. Actually, the health professionals representing the government originally downplayed the seriousness of SARS. The Health Secretary Yuan Wing-kyung refused to don a mask in public, believing that the virus was transmissible only through intimate contact. Margaret Chan Feng-Fu-Chen, the former Director General of the WHO, the Director of Health of Hong Kong at that time, stated that wearing masks was effective for healthcare workers and patients, but for citizens to wear masks in the community settings, she said, is still a debatable issue. Various health professionals and doctors also doubted the effectiveness of using a mask to prevent getting the diseases in the community settings. However, it did not stop the general public to stop wearing the mask. The mentality of the public who choose to wear the mask was somehow self-assuring in nature. The following column article may convey their mindset. People are illogical in this situation. They totally understand wearing masks is not that effective when it comes to prevent getting infected, especially wearing those gauze masks with simple design. But sometimes, in order to be self-assured, even you know it is probably useless, you have no choice but to do a little bit more. The health professionals determined wearing masks as ineffective based on scientific evidence. However, their rational mindset could not help alleviating the public fear on the pandemic. It was summarized very well in one research paper. The result of their scientific mindset was a pronounced tendency to consider public fears as irrational. On March 15, Arthur Lee insisted that school closures were unnecessary because schools were the safest place to be. That may or may have not been true. But their attitude was to make them appear dilatory or indifferent to the urgent desire of parents to protect their children. This could apply to advices on wearing masks as well. So the history of surgical mask ends here. In the next part, we will delve into the detail of the surgical mask.